Diabetes distress is the emotional distress. This is often the result of feeling overwhelmed due to the burden associated with their relentless daily self-management, fear of long-term complications, and may also include financial stress. Some people can face stigma, discrimination, or lack of understanding from friends or family about their condition. People with diabetes are more likely to experience mental health problems, in particular major depression, anxiety disorder, and disordered eating. Diabetes distress is a condition distinct from other psychological disorders and is estimated to affect between 18 and 45% of people with diabetes and is often unrecognized. Peaks in distress may be seen at or shortly after diagnosis, following changes in treatment, when there is a diagnosis or deterioration in complications, when the HbA1c target is not achieved despite their best efforts, and during other life upheavals and difficulties. Diabetes distress is associated with suboptimal diabetes self-management, HbA1c not at target, more frequent and severe hypoglycemia, and impaired general emotional well-being. Although diabetes distress has some similarities to depression, it requires quite different assessment and management. So how can you identify diabetes distress? You could ask open questions such as, how is diabetes bothering you at the moment? Or, what is the most difficult part of living with diabetes? There are 2 screening tools recommended in the RACGP handbook. The first being the Problem Areas in Diabetes, or PAID scale. This is a psychometrically sound tool. It's a 20-item questionnaire and covers a range of common negative emotional problems. Patients receive a score out of 100, and anything above 40 is indicative of severe diabetes distress. The second tool is the Diabetes Distress Scale, or DDS-17. This is a 17-item questionnaire that measures diabetes-specific distress in 4 domains: emotional burden, interpersonal distress, physician-related distress, and regimen-related distress. A mean score of 3 and above in any domain indicates high distress. Diabetes distress is best managed within the context of diabetes care. Once diagnosed, it should be regularly monitored at initial consultation, then at periodic intervals such as annual review, and when there is change in treatment. Patients identified as having diabetes distress may prefer to work with their diabetes team rather than be referred to a mental health specialist. If the patient is distressed and the scale shows that it is not caused by diabetes distress, consider other psychological problems such as depression or anxiety. Simply identifying and acknowledging diabetes distress can be helpful for a person with diabetes. For more information, refer to the chapter on mental health and type 2 diabetes in the RACGP handbook.